Welcome to The Explainer. Listen, if you or someone you love is currently navigating the world of fertility treatments, I just want to start off by acknowledging something super important. You are on a journey that takes, well, immense strength. It's a path full of hope, absolutely, but man, it can also be incredibly complex and just emotionally exhausting, right? So today, we're going to walk through this together. We're going to take some of the fear and mystery out of the medical side of things and specifically focus on the fascinating and honestly deeply empowering world of fertility genomics. Because let's be real, if you've spent even 5 minutes looking at clinic brochures or Googling late at night, you've probably felt totally overwhelmed by the alphabet soup of medical jargon. SHG, EMA, ALIS, PGT, SDF. It's like, do you need a medical degree just to understand your own body? I really want to validate that frustration. It is entirely normal to look at this barrage of acronyms and just feel a wave of anxiety. You're already dealing with so much and trying to crack some secret clinical code that shouldn't be added to your plate. So, okay, let's dive into this. Consider me your friendly translator for today's explainer. We're going to decode these terms together, step by step. We'll strip away all that intimidating clinical language and just look at what these tests actually mean in plain everyday English. Because, when you understand the tools available to you, you shift from feeling like a passive patient to being an empowered partner in your own healthcare. It's a real game changer. Let's start with the big picture, genetic testing. Now, it's pretty easy to view medical tests as cold, sterile procedures, but in the world of assisted reproduction, genetic testing is actually profoundly personal. It's a tool that allows doctors to make highly accurate diagnoses. Think of these tests as vital stepping stones. They empower your medical team to completely personalize your fertility treatment. They aren't just clinical hurdles, they're essentially the blueprints that help your doctor tailor a path forward that is uniquely and specifically designed just for you. All right, let's look at phase 1, understanding your body. Before an embryo can grow, we have to make sure the space it's going to call home is as healthy and welcoming as possible. So, one of the first acronyms you might bump into is SHG, which stands for sonohistogram. Now, I know, sonohistogram sounds like a terribly long, intimidating medical procedure, but let's simplify it. It is literally just a special type of ultrasound. The absolute key word here is non-invasive. No incisions, nothing like that. It's just a gentle, non-surgical way for your doctors to get a crystal clear picture of the inside of the uterus. It's really just mapping the territory. Next up, you might see the names Emma and Alice. And no, these aren't people working at the clinic. They stand for endometrial microbiota analysis. Basically, the human uterine lining, the endometrium, relies on this really delicate balance of microbes and cellular immune responses. Think of it like checking the soil before you plant a very precious seed. The Emma and Alice tests evaluate that delicate balance, just making sure the uterine environment has the right healthy bacteria and the right immune conditions to welcome and nourish an embryo. Moving right along to phase 2, exploring male infertility testing. Because fertility really is a shared journey, and this brilliantly illustrates that. On the left, we have the uterine environment we just talked about, and on the right, male diagnostics. It's a true 50-50 partnership. Modern fertility care looks at the entire picture, testing both halves equally to make sure absolutely nothing is left to guesswork. When it comes to the male side, doctors might use something called sperm aneuploidy screening. Simply put, this is a diagnostic tool used to check the genetic health of the sperm itself. By looking at the chromosomal makeup down at a microscopic level, this screening plays a huge role in figuring out the absolute best treatment options for male infertility. It essentially guides the clinic in choosing the right path forward, instead of just relying on trial and error. Another really vital diagnostic test here is SDF, or sperm DNA fragmentation testing. Now, a standard semen analysis might just look at how many sperm there are or, how well they swim, but SDF testing goes much deeper. It analyzes the actual DNA integrity within the sperm. If the DNA inside is fragmented or kind of broken up, that can actually impact how an embryo develops. So knowing this acts as just another crucial piece of the puzzle for personalizing your care. All right, on to phase 3, screening your embryos. So the crucial point is, once we understand both partners, we need to establish a baseline, and this is often done through something called chromosomal karyotyping. This fundamental test maps out the chromosomes of the intended parents to look for any major structural abnormalities. It gives doctors this foundational genetic roadmap, helping them understand the base genetics involved before the embryos even begin to develop in the lab. And that brings us to one of the most common, yet probably most confusing acronyms in all of IVS, PGT, or pre-implantation genetic testing. I want you to think of PGT as a helpful umbrella term. And underneath this umbrella, there are three main categories: PGT-A, PGT-M, and PGT-SR. Instead of letting all these letters intimidate you, let's just break them down one by one so you can see exactly what they do. First up is PGT-A, which stands for Pre-Implantation Genetic Testing for Aneuploidies. Formerly known as pre-implantation genetic screening, this test actually has a very straightforward job. It simply checks that an embryo has the correct number of chromosomes. Too many or too few chromosomes can lead to failed implantation or a miscarriage. By making sure the embryo has the exact right number, PGT-A gives that embryo the very best chance to grow into a healthy pregnancy. Then we have PGT-M, which targets monogenic or single-gene disorders. This one is highly personalized. If you know that a specific single genetic disease, something like cystic fibrosis or sickle cell anemia, runs in your family, well, PGT-M is what they use. It's a super targeted test that helps doctors identify which embryos do not carry that specific gene, ensuring the disease isn't passed on to your future child. And finally, under that PGT umbrella is PGT-SR. This tests for structural rearrangements. Sometimes a parent can have pieces of chromosomes that are kind of swapped around or rearranged. The parent is perfectly healthy, but it can cause issues when passing those chromosomes down to an embryo. PGT-SR is designed specifically to detect these inherited structural issues in embryos prior to their transfer. It's all about giving you some serious peace of mind before taking that next big step. Now, phase 4, finding answers after loss. I want to soften the tone a bit here because, for many, this journey unfortunately includes the profound heartbreak of miscarriage. If you have experienced this, please know your pain is so valid and you are absolutely not alone. Now, the clinical term product of conception, or POC testing, sounds incredibly cold. But what's really interesting about this is that testing the tissue that remains after a loss is actually a profoundly compassionate tool. By testing it, doctors can often discover the genetic reason why the loss occurred in the first place. It brings much-needed answers, it can remove that heavy burden of wondering what went wrong, and it can provide crucial closure and direction moving forward. And finally, phase 5, personalizing your path forward. Armed with this knowledge, from understanding your uterine soil, to evaluating sperm health, to screening embryos, and even finding answers in loss, we can look back at all those acronyms. They aren't quite so scary anymore, are they? They are simply tools to build your unique, personalized roadmap. So as you prepare for your next clinic visit, instead of wondering, why is this journey so hard? What if you walked in empowered to ask, which of these decoded tests holds the missing piece to my unique puzzle? Thank you so much for joining me on The Explainer. Stay curious, stay hopeful, and please take care of yourselves.